Hey, I am Teresa Kenny, a nurse practitioner, and I am going to be showing you how to give a self-progesterone injection. For the sake of the fact that this is going to be a complete video, hand sanitizer, or wash your hands before. I have my progesterone vial. Yours will look somewhat like this with oil in it. You're going to clean off the top of the progesterone vial with alcohol. Now you should have 2 needles given to you. This is most of the time. You have one that's a short, fat needle. It's called an 18 gauge needle. You'll screw that one on your syringe, your 3 ml syringe. You will pull it back to the amount that your doctor wants you to give, and you will fill that with air. You will inject the top of the vial, push the air in, turn the vial over, and you will inject or pull back to the amount, again, that your doctor wants you to administer. I'm doing 1 cc for 100 milligrams. Once I get to 1 cc, I can pull all the way out. Then what I'm going to do is recap that needle. This is the safest way, is just to put it on the table and to let it kind of go on naturally. These lefty-loosey off and righty-tighty on. So lefty-loosey off. And then I have my administration needle, which is a longer, usually a 22 gauge, 1.5 inch long needle. And I'm going to righty-tighty that on. So now I have 100 milligrams of progesterone ready to go, and I'm going to administer it to myself. So how do I do that? I have a Band-Aid and a cotton ball ready and my alcohol wipe here. I'm going to find the place that I want to do. Generally, if you're right hand dominant, it's easier to do the right side. So what I'm going to do is pull down my hip area, because we're going to give this in the outer quadrant of the hip, right? I'm going to pull up. Sometimes I tuck my shirt under my bra, just so I can see what I'm doing here. The way that I try to find my spot is I find the top of my iliac crest, which is that bony prominence right here, and I just reach back, almost like I'm making a C right here, and I squeeze. Generally, that's going to be about the right spot. So again, top of the iliac crest, I'm going to reach back all the way with my thumb and squeeze. Usually that spot is going to be in your outer hip. It should be about lateral with your butt crack, so you don't want to be higher than your butt crack or lower than your butt crack. You definitely don't want to give the shot anywhere that your butt is, like the part that you sit. This is in the outer hip part. So again, I'm going to make that C, and I can almost feel that's like a nice jouncy part of my hip, okay? So once I identify that spot, maybe like I have some scars there, I kind of know my landmark, or you can even mark it with a pen, okay? So I'm going to go right about here. So what I'm going to do is I'm going to clean that off with alcohol. Sometimes I just let that dry, or you can take your cotton ball and just wipe it dry. I have my progesterone. What I'm going to do is just pull off the cap. Again, I know this can be, generally you want to make sure that if you're someone who gets lightheaded easily, you have a chair behind you or a couch behind you, something to sit on. If you, for whatever reason, get lightheaded, you can sit down right away, okay? So I'm gonna find my spot again. This is a 90-degree angle. All I do is I bring it as close to the skin as possible. I even can lightly touch almost, can barely feel it, and I'm just gonna push. I give it a little shake because I can't even feel it then. You're gonna go all the way in with the needle, and it will be okay, I promise. And I switch my fingers, you can see, down to the bottom of the plunger. And what I'm going to do is just push that really nice and slow. Can you see that bubble in there? I do, if you can't see it. But I just want to tell you, do not freak out at bubbles. Bubbles are not a big deal. A little bubble in there is totally fine. So do not panic if you see a bubble. It cannot hurt you. And again, you're going to be giving this probably over a minute. If you're doing 2 mils, you're going to give it over 2 minutes at least. Real nice and slow. What I love about this is that I control it. If I want to stop for a moment, I can stop, and then I can push again. It's not hurting at all. There's no pain, and there really shouldn't be. You might feel a little pressure or a little twinge, but it really shouldn't be painful at all. So I'm going to continue to push this, and I'm going to look for my cotton ball, because you're going to need that when we're all done with this here in a second. All right, so I pushed it all in, so the needle just pulls nice and perfectly out. Sometimes you'll see blood, sometimes you won't, sometimes you'll see a little oil. So I'm just gonna hold that cotton ball on for a second, and then I'm gonna get my Band-Aid ready. It's nice to have this all set out so you have everything right there at your fingertips. And I'm just gonna throw that Band-Aid right on that spot. And that's it. Super easy. Again, if you're right hand dominant, generally it's easiest to do it on your right hand side because it's harder to reach around to your other side. So I would say try to stay on your dominant side and that hip. So remember always lateral hip, jouncy muscle right there. You shouldn't be pushing into anything hard like a bone. It should feel like a real jouncy muscle. And again, know where you sit on your bottom. And that should make it go really smoothly. So I hope that's helpful. Thank you.